What if I told you your back pain might not actually be a back problem? Stick with me for a second, because if any of the 7 signs I'm about to walk through sound familiar, there's a real chance the issue isn't your posture, your mattress, or how you're sitting. It's your gut. By the end of this video, you'll know exactly which category you fall into and what that actually means for what you try next. Hey, welcome back. Today's a little different. Instead of a straight product review, I want to walk you through 7 specific signs that suggest your back stiffness might have a gut health root, not just a mechanical one. If you recognize 2 or more of these, that's genuinely worth paying attention to. And toward the end, I'll talk about what actually helped me once I recognized this pattern in myself. Quick disclosure up front. Later in this video, I mention a product that includes an affiliate link. Full details in the description. Quick bit of context before the list. Most back pain advice assumes your spine is an isolated mechanical system. Fix your chair, stretch more, sleep differently. And that advice isn't wrong exactly. It's just incomplete for a specific group of people. There's a growing body of research into what's called the gut-spine axis. The idea that chronic low-grade gut inflammation circulates systemically and can contribute to stiffness that has nothing to do with your desk setup. This is still a developing area of research, not a settled fact for every single person. But it's real enough that it's worth checking whether it applies to you. That's what these 7 signs are for. The 7 signs. Sign 1. Your pain moves around or shows up alongside other joint achiness. If your stiffness is always the exact same spot, same intensity, every time, that leans more mechanical. But if you also notice occasional achiness in other joints or a general inflamed feeling that isn't localized to just your lower back, that's sign number 1 that something systemic might be involved, not just one overworked muscle. Sign 2. It's noticeably worse the morning after certain meals. Mechanical pain generally doesn't care what you ate for dinner. But if you've noticed your back feels distinctly stiffer after a heavy, processed, or high-sugar meal the night before, pay attention to that. It suggests your gut's inflammatory response to that food may be adding a load your body has to deal with overnight, and that shows up physically by morning. Sign 3, sears, heat and stretching only give you minutes of relief, not hours. If a heating pad or a good stretch genuinely resolves things for the rest of your day, that's usually a sign your issue is surface level and muscular. Keep doing what's working. But if relief fades in 15 or 20 minutes, and you're right back where you started, that's often a sign the source isn't just muscle tightness. Something is still active internally that surface treatment simply can't reach. Sign 4, you also deal with bloating, irregularity, or low energy. This is probably the single biggest tell on this list. Back stiffness that shows up alongside digestive symptoms, even mild, easy-to-ignore ones like occasional bloating or sluggish digestion, is a strong signal that your gut and your back pain aren't unrelated. At that point, the gut-spine connection isn't really a stretch anymore. It's often the more obvious explanation. Sign 5, nothing's gotten worse, but nothing's gotten better either. Sometimes the sign isn't a new symptom, it's a plateau. You've done everything right for months, and you're just stuck. That flat line is often exactly what happens when you've maxed out the mechanical fixes, and the remaining piece is internal rather than postural. Sign 6, stress spikes seem to make your back worse, not just your mood. Here's one that surprises people. Gut health and stress are deeply connected. High stress periods can measurably shift your gut's inflammatory response. If you've noticed your back gets noticeably worse during stressful weeks, independent of how much you're moving or sitting, that's a sign the gut inflammation pathway may be playing a bigger role than you'd assume. Sign 7. You've tried multiple back pain fixes, and none of them fully worked. And the last one ties everything together. If you've genuinely tried the standard playbook, posture correction, stretching, a better chair, maybe even physical therapy, and you're still dealing with regular stiffness, that's not a personal failure, and it's not a sign nothing works. It's a sign you've been solving half the problem, the mechanical half, not the internal one. What to actually do about it? So if you recognize 2 or more of those signs, what now? First, none of this replaces a doctor's evaluation if your pain is severe, sudden, or radiating. That always deserves a professional opinion before anything else. But if what you're dealing with is chronic, low-grade stiffness with some of those gut-related patterns, that's the specific gap a gut-focused approach is built to address, rather than another stretch or another chair adjustment. This is the exact reason I started looking into BackBiome, a probiotic supplement built around supporting gut inflammation balance rather than targeting the joint or muscle directly. To be clear on realistic expectations, this isn't an overnight fix. Most people, myself included, notice gradual changes over 4 to 8 weeks, not days, which actually lines up with how long real gut microbiome shifts take biologically. That slower timeline is a sign something real is happening, not a red flag. Same caution I give in every one of these videos. If you're pregnant, breastfeeding, immunocompromised, or on medication affecting gut or immune function, talk to your doctor before starting any new probiotic. And again, sudden, severe, or radiating pain needs medical evaluation, not a supplement. This approach is for chronic, low-grade stiffness, not acute injury. If you recognized yourself in a few of these signs, I'll leave a link to the full breakdown of what I tried in the description. That is an affiliate link. Drop a comment and let me know. How many of the 7 signs did you recognize? I'm genuinely curious how common this pattern is. If this was useful, subscribe for more honest, no-hype breakdowns like this one.